Hi, welcome to Nurse Chats. Today, let's talk about the masks that we've all been asked to wear, some of which are uncomfortable, irritating, cause what are the many objections we hear that they cause uh, uh, acne. We don't like the mask because it's causing our skin to break out. And so I'm going to give you some suggestions. Okay, first of all, I think you should find a mask that works for you. Okay, so what you want to do is have one that fits really your face size. So there's different sizes. Okay, so if you have a small face, pretty small face, you want a smaller mask, as in a child. Some of us have small enough faces that we're almost in the child category. Okay? So we don't want things up here on our eyes because that does not feel good, and our glasses fog up and they're irritating. So there's a variety of ways you can get masks that you like. Okay, but before I talk about the one I like, or at least I found that I like, I want to talk about the ones I didn't like for a while and why I didn't want to wear the masks. Okay, so I had a disposable mask like so many of us. Okay, this mask is seen everywhere, right? So this is very common. This is the disposable mask. It has two sides. There's a lighter side and a darker side. Typically the darker side faces out. Okay, so I did see somebody with a mask upside down the other day, so that it's not as self-explanatory as we think. Okay, so this is the proper way to use a disposable mask. Okay, I'll demonstrate, but I also want to say that some of us had jobs, in our lives, like nurses and doctors, who wear masks as our living. So those of you who hate to use a mask, I'm going to say, there are jobs that are out there where people wear a mask, and why do we wear them? And there's a lot of reasons in our job, but also just realize that in our case, we're wearing it because we have that job. We chose that job. We're grateful to have that job. And so if you're working in an operating room, you're going to be wearing a mask. Okay, masks have different purposes in a sense. In an operating room, we're trying to prevent the transfer of bacteria from the patient to us, or us to the patient, in terms of a barrier to the actual environment, if you will put it that way. And I'm saying this very lay terms, but as opposed to necessarily what we're talking a lot about with COVID is droplets. Okay, so droplets are out there when we sneeze, when we cough, when we talk, when we sing, those kinds of things. If you ever sneezed into the sunlight, you can see how far the spray goes, and it's quite a ways, right? So if you've ever seen that with the sunlight in the window or outside and you sneeze, it goes quite a ways. And during COVID, we've been talking about a 6-foot distance for safe distancing. And in the old days, it was a 3-foot difference. And we were saying, 3 feet for the average cough. And probably 6 feet is average for sneezes and things, for spray, when we're talking about droplets. Okay, so these masks are only good, they've done studies, as far as the breath barrier for about 10 minutes or so, right? Maybe. And they get saturated per se, and the breath barrier is breached. But for droplets, that's different. Okay, so if you put this on and you sneeze, that you're stopping the spray. Okay, you're not stopping your breath, you're stopping your spray. And so that makes these more appropriate and friendly for wearing longer during the COVID, and any influenza season. Okay, so you can walk around with these for a couple hours, right? So you don't want to wear them again tomorrow. Just so you know, it's it's a one-time day thing, and these are $2 a piece, so they're not cheap. So you may want to consider getting a mask that works for you, that you're going to be using for years to come, because infectious disease is here to stay. It has been here for years and years and years and years. As we know, the Spanish flu happened 100 years ago, and a third of the world had it at that time. So every year we all get the flu season. So we know that infectious disease is going to be an issue in the future. And what we've learned through COVID hopefully should to stay with us. The people in existence today, while COVID's the history maker, this will hopefully stay with our population in the future. Okay, so I like to bend there's a top part and the bottom. Like I told you the other day, I saw someone with one upside down. I've seen people with it inside out. That's not so much a problem, except the mask is made to puff up over you, and if you're wearing it backwards, it won't do it the same way. It opens differently, so you have pressure in different areas. So if you can, wear the dark side out, and then the top has a bar, a little wire in it for forming around your nose. Okay, so what I was going to say about that is I like to bend it first and let it expand to my nose, as opposed to putting it on my nose and letting it expand, if that makes any sense to you. So once I put it on my nose, it expands to the appropriate size of my nose, as opposed to putting it on my nose and trying to form it way out here. So I bend it, and then I put it on my nose, and then I fit it over my ears, and then it's expanded to my nose, and it has a better fit for me. I can press again and make sure, because it's really not pleasant to have that air going up into the eyes. Okay, so we wear the neck snugged around here and maybe press here a little bit for comfort, so your eyes don't get breath on them as much. Okay, and then here, then you adjust to your size, what's comfortable for you. Pull those pleats a little bit so you'll have a little bit of air, and make it for you, what you like. Okay, so that's one way to use the disposable mask. The things I don't like about the disposable mask are that they are one size fits all. They get a little fuzzy on the inside from rubbing, like as you talk and move it, the inner fibers get looser and it's more uncomfortable. It gaps. There's just some things about a disposable mask that might not be for you. Okay. And again, one size fits all. It's a little big for my face. It's going up towards my eyes a little more than I want, and I have to keep forming it or pulling it, and you see people adjusting a lot because it's one size fits all. Like I say, they're expensive. If that's all you have and you want to deal with, but I'm just telling you there's another option. One would be to get a mask that's more durable, multi-use, washable, and so that you can have, now the more durable, washable type mask is different sizes usually, and you can get a large, medium, or small. I got a small in this case because my face is a little smaller, and so I take this mask. This one doesn't have a wire, so I may end up finally finding one with a wire. But I did like the very soft material of this. It's very comfortable. It pouches out a lot, so it won't hit my mouth while I'm talking. And then it's so easy to put on. And then I put it on like that. It covers nicely. There's not a big gap here. This is giving me breathing room here, and I feel it's comfortable and soft. I don't hardly feel it that way on my face. Okay. I don't really feel I need the wire because it form fits very well. Okay. I like the pink color, so that was appealing to me as well. I did put a little bit of essential oil in a baggie and put my 3 masks. They came in a package of 3 in a Ziploc bag for my purse, so these don't get dirty from whatever's in my purse or on my car seat when I throw it in. It's in a zipped baggie. That's how I like to take it. And then I put a little bit of essential oil that I like, a scent that I like, lavender, for instance, or something that I want that will make me feel happy while I'm wearing the mask. The mask is made of material that's antibacterial, apparently, but it's washable. That's what's antibacterial. So it's going to be that you're going to wash it daily and not reuse without washing. Okay, so as you wash your face, at the end of the day, hopefully, then you wash your mask in some nice mild soap and rinse it and air dry it overnight. That's how these masks work. There's all kinds of styles of masks now. Like I say, there's different sizes of masks now. That's nice. The inappropriate way, and I'm going to mention this because I see it all the time, to wear a mask is to cover only your mouth. What's wrong with that picture? If you sneeze, you don't have your nose covered, okay? So not good, not a good idea. That's not doing anything for anyone. None of us like the whole thing of the air going in our eyes and our glasses steaming up and all those things. I'll put my glasses on and put this mask on. And again, you want to be able to form it where you need it. And you want it comfortable. You want to cover your nose. Fit it around, fix it to where you like it. You can even put it down this far if you want. But see how my glasses are fogging? That's because air is coming up because that gap is too big right there. So I would wear them closer fitting so you don't get the fog face. As far as acne and breakout, you want a material that is very, very breathable. This is a little thicker material to conform more with more protection when I'm out and about, because I'm a registered nurse, so I might be seeing people and I wanted a little thicker material. If you're making a homemade one, that's fine. Again, wash it. There are people using material that's literally so light that you think, oh, is it even doing anything? If you're preventing spray, you are still doing something. So if you go into a public place, church, the store, wherever, and you do happen to cough or sneeze, of course, coughing, we know you cough into your arm here, you don't touch with your hand. But still, with a mask on, you're preventing spray. You're preventing spray. That's the big idea, is that you don't want to spray your cough out to other people. And then your sneeze is just almost worse. You know, the more achoo, and especially a forceful sneeze, just goes way out there. Those are droplets, okay? There's plenty of ways that we all have droplets. Urine splash is droplets. So droplets, when you're talking about droplets, you're talking a little bit different than maybe air, if you want to put it that way. And again, it's being very elementary and very, very, it's talking like a layperson that a layperson can understand, as opposed to a medical professional in a medical professional job. But for all of us walking around, realize that you have spray droplets. You wipe your eyes, you touch it, that's got moisture. Okay, those things, touching your bottom or wiping your bottom and not cleaning. The hygiene part of it is another huge aspect of this. But today I'm talking about masks. Okay, find one that works for you. Find one that you like. Explore a little bit. Don't be so resistant, and find something that you say, you know what, I could do that. I can do that. I can wear that, because you know what, it's important, and we're trying to educate the public on a large scale of things that we've known for years. And the public is now hopefully, getting to the point where they're listening and saying, I don't want my best friend to die. I don't want my family member to die. So if I can do my little part, and if I can make it easy on myself and make it something pleasant for myself, yay. And if your mask has a message on it, or, all these different masks that people are wearing, fine, do it. Like t-shirts now, that we're going to have masks that are like t-shirts. In the old days you wore a t-shirt to make a statement, and now it's going to be your mask because it's right below your beautiful eyes. And, people are looking at your eyes more now. And so that's maybe a good thing. right? So let's keep working on this together. If you have questions about wearing a mask, go ahead and put that as a comment. And we'll talk more about things as we go along. I'll talk more about hygiene and good hand washing techniques next. But we've all learned a lot about all of that. But we still have to be reminded, and we're still a little resistant. So let's try to, in this next phase of everything that we're going through, let's try to have a better attitude and try to maybe put yourself in the shoes of a nurse or a doctor who you say, we wear masks. Why? Because we know what's in the room, you know? And so I want you to be really, really thinking about how you can better serve your fellow man and yourself by finding what works for you and what is affordable. That's another thing. Is again, $2 a pop for a disposable mask is a lot of money. And hopefully we can, if that's still your option and you like that, the weight of it, whatever, you know, use it when you can and use it as often as you can, especially in any social setting of any kind, one-on-one even, okay? And we'll talk again. And thanks for listening, and thanks for coming to Nurse Chats today, and I hope to talk to you soon. Okay? Bye-bye.